Experts are calling for Australia to start utilising people who've already had coronavirus and may have recovered in essential jobs. It's believed that at least 20% of cases in Australia could be asymptomatic, meaning they've had it and not shown any symptoms. And if correct, that would then give us thousands of Australians who are already immune and could therefore safely return to work. We first discussed this, in fact, a couple of weeks ago, but it's now getting some serious consideration by experts. One of them who backs this being Professor Nigel McMillan, Director of Infectious Diseases and Immunology at the Menzies Health Institute in Brisbane, and he joins me now. Professor, thank you very much for your time. Terrific piece I read today where you're saying we need to be quite elastic in our thinking. We should look for Australians who have already had it, either knowingly and recovered, or those that haven't had any symptoms but might have been exposed, so we can put them in the front line. Explain how that might work.
Well, I think we need to be creative in how we go about this, and we've already seen a number of really creative responses from the government, and what I'm asking for is the government to start thinking about this. So anyone who's had the coronavirus infection will be immune to it, and we have good evidence for that, and some good experimental evidence and evidence from past coronavirus infections. These people would be able to go back to their jobs, but I think most importantly, these would be particularly useful if these were medical frontline users. So these are people who would be treating in the ICU or treating patients, people who are in first responder type jobs who might interact with sick patients. Pilots, air hostesses who are in much higher danger. We could make use of people like that particularly who are immune to the virus and therefore could go about their jobs in a normal way.
Are we sure that people can't be infected twice, at least in one sort of season? There's no worry that if you put them out there in harm's way again, they could transmit the virus?
Well, we know with our normal coronavirus infections that the immunity lasts 6 to 12 months, so it's not lifelong like chickenpox where you get a vaccine and you'll have lifelong immunity. It doesn't last quite as long as that. And for COVID-19, we really don't know yet, of course, because we've only been at it 3.5 months. But we have some experimental models where they've used primates, which they've challenged with the virus and then allowed them to recover, and they can't be reinfected. And now, of course, we do see the occasional anecdotal report of people testing negative, but then coming back and testing positive. But these are very few, and what we suspect is happening there is that the negative test wasn't particularly negative, and there are a few individuals who seem to shed the virus a lot longer. So for these workers, it would be very important that we can show that they make antibodies to the virus, and that's through the blood test, and also that they're not shedding the virus, and that's just through the normal PCR test.
Now, you have also picked up that researchers in Germany are looking at immunity passports, if I can call them that, and in the United Kingdom, they're looking at giving wristbands to those who have already had the virus and come through the other side. Is that something we should have on the table here?
Well, I think it's something for the government to consider how they might want to implement this, but we have to think, what is our end game? And the end game is we want the population to be immune. And that's only going to happen if we have a vaccine or if everyone gets infected. And if everyone gets infected, we know we have some fatalities. So the vaccine would be better. But as time goes on, we're going to build up more and more of these people. We have at least probably more than 750 recovered patients in the country now. And so these are people we could be putting to use. The actual details of how you would issue such a passport, how you'd keep a database, I think would probably need to be worked out by government. But they're a very valuable resource. They would do a number of things. For example, they would put people who were otherwise in harm's way out of harm's way. We would save on PPE, for example. They wouldn't need to wear such extensive PPE in the hospitals when they're treating or dealing with these patients. So once again, I'm just calling for the government to think about how they might want to deal with this. It's going to be something that every government in the world is going to have to think about, because we're going to get more and more of these recovered patients as the pandemic goes through the population.
Is there any risk, Professor McMillan, it could lead people intentionally seeking to contract coronavirus in order to get back to work? Let's say they've been hit hard with income losses, that they go out there and take a punt to get it so they can get back to work?
Yeah, and I think the Health Minister was just alluding to the fact that most people are doing the right thing, and there's the occasional individual who won't. Look, the idea that you could get this virus and come through unscathed is not true, while 80% of people will have mild infections, we've now seen a number of very healthy young people who have passed away from this particular disease, and we actually don't really understand yet why young healthy people are having this. Certainly it affects the older population more, but it's not a lottery that I'd buy a ticket for, that's for sure.
Right, in Victoria, we've heard today the government will start testing people 65 years of age and older. Explain to me, what's the rationale in doing this? And should we do it nationwide?
Yeah, so I think that, and Queensland's also announced that they're going to widen their testing regime as well as WA. So I think the rationale here is that we now know that most of the cases that we have been imported from overseas, and that the implementation of the blockade of those passengers on March 22nd is now coming through in our numbers. We can see our numbers dropping. So the next phase of this is community spread. And so by widening our criteria, we're now going to allow doctors to have a little more leeway in testing people who they might suspect have a number of symptoms but otherwise wouldn't have qualified before. And we don't know what we don't know, so if we're testing more widely, we're going to catch those individuals who may have very mild symptoms in terms of being able to trace, isolate and get them out of the system. That's really the only hope we have of stopping this thing, and that is making sure that we track, isolate patients and their contacts. New Zealand probably has the best chance of actually stopping this virus in its tracks because they got onto it really early. We might do that, but I suspect we're going to have this really circulating around the community quietly for the next 6 months at least.